When the hip joint becomes severely damaged due to conditions such as arthritis or injury, and other treatments no longer relieve the pain, surgeons may remove the damaged parts of the joint and replace them with artificial components designed to restore smooth movement, reduce pain, and improve mobility. During total hip replacement, the surgeon accesses the hip joint and removes the damaged head of the femur. The hip socket acetabulum is carefully prepared using specialized instruments to create the correct size and shape for the implant. A metallic shell with a cup-shaped liner is then placed into the prepared socket. The damaged femoral head is replaced with an artificial ball attached to a stem, which is inserted into the hollow center of the thigh bone and secured either by press-fit fixation or bone cement, depending on the surgeon's preference. The artificial ball and socket are then joined to complete the reconstruction, creating a smooth and stable hip joint. The goal of total hip replacement is to relieve pain, restore movement, and improve the patient's quality of life.